Okay, so we're going to look at a kinesiology taping technique for patellofemoral pain or anterior knee pain. So we know there's a number of different causes that can trigger patellofemoral pain. One of those things is an imbalance between the quadricep muscles, which creates a lateral tracking. That's how most people kind of understand this condition. There are some other factors that can play into it. The technique that we apply for it, though, is consistent regardless of the trigger, if the pain is anterior or patella originated. So in this case, we've got a patella that's creating some compression against the femur. There's some irritation, so we want to use the taping technique to decompress the patella away from that femur, reduce a little bit of that compression, reduce a little bit of the irritation that's coming from behind it. So we need to pre-cut some tape. I've got 2 strips of rock tape branded tape here at the moment. There are long strips, and then we've got 2 shorter strips, one slightly longer than the other. So with the tissue in a gently stretched or lengthened position, so we've got our patient here in a seated position, knee flexed, we're going to apply the tape from the tibial tuberosity, and we come around the patella up onto the thigh. It's important when you're using kinesiology tape that you don't apply any stretch to the first couple of centimeters. So we're going to peel back that tape, apply it to about the tibial tuberosity or thereabouts on the front of the knee. No stretch on that part of the tape. Lock it down. We then pull the backing of that tape back, and again hold that last couple of centimeters with the backing still on there. We then take that tape with a gentle tension, about 20%. That's debatable, the exact amount of stretch you need, but a gentle stretch. We go around the patella and up onto the quadriceps. No stretch on that last couple of centimeters, just as we did at the start. That's our first piece. The second piece starts at the same point. This tape, remember that it sticks better to the skin than it does to itself. So we want to anchor that second piece of tape next to the first one, try not to overlap it too much. We then bring this back. Again, no stretch on the last couple of centimeters. Apply a gentle stretch to the long strip around the patella, up onto the thigh. Okay. The glue on this tape is heat activated, so if you rub the tape, it sticks down a little bit better. Warm it up. Our next 2 strips. The first one is the shorter one. This one is a decompression strip, so we're going to take the back of that tape, tear it down the middle, and then peel the backing back again to that last couple of centimeters. This is a stronger stretch we apply to this. We're talking about 80% or thereabouts, 50 to 80%, somewhere in that range of stretch on the tape. We're going to place this one just under the patella, so pretty much across the patella tendon. So we go across, stretch that tape out, lay it across, and then pull up, almost in a little smile underneath the knee. No stretch on that last couple of centimeters again, either side. We then take the other decompression strip, slightly longer than the first one. It's going to go across the thigh, which is why you need a little bit wider than the first one. Again, tear the back of the tape down the center. Peel that one back. Last couple of centimeters, no stretch. Hold the tape. Above the patella, which is here, across the top, this time more of a frown shape. Feel it down over the top. Lock it down on the knee. So we've got 2 longitudinal strips, 2 decompression strips, and what we'll find is when our patient stands up, the nature of that elastic tape will recoil and we'll have a lifting of this tissue, and it's going to look like very much like an old man knee. Let's have a look. So will you stand up for us? I think you can almost see it on the camera there, but the skin's kind of puckered up over the top of the patella, creating that decompression, just enough to unload the patella and hopefully reduce some of the pain. What you'll find with people who have quite acute anterior knee pain is applying this tape can literally take the pain away like that for them, which then will allow them to be more proactive with their corrective exercises, increase compliance, and help them recover faster in combination with other modalities and the corrective exercises that you've applied.